Good afternoon, Senator Castro, members of the Executive Committee. My name is Bob Gilligan. I'm with the Catholic Conference of Illinois. I'm here to oppose Senate Bill 9. Matt has a PhD. We never coordinated our testimony, but I feel really good because a lot of things that I'm going to say is almost what Matt said. So I will try to work around some of the things he said because it's very similar to our beliefs. Senator Holmes, at the beginning of the hearing, you asked the question, as Matt just outlined, about, well, why can't we just let people die? What is it? What is our concerns about this? You don't understand. I guess in a phrase or a sentence, what I would say is that the societal harms of legalizing assisted suicide far outweigh the benefits that those who want to die at the end of life to elicit a doctor to end their life. So the societal harms far outweigh what would happen if we legalized this. We have now data from Oregon and from other states and other countries. And the three harms that I would point to, the societal harms, are, as Matt indicated, a suicide contagion, the potential for coercion and abuse that I'd like to talk a little bit about, and the way medical care is changing in our state, where insurance companies have figured out that sometimes, unfortunately, it might be less expensive to provide the prescription pills to end your life than it is to treat you. Those are the three main societal harms we see with Senate Bill 9. I don't want to say exactly what Matt said, but one of the things about the suicide contagion issue that I think it's important to point out is that you are now, the state of Illinois, the policy is to bolster mental health services and to try to curb the number of suicides, whether it be for our school-aged children, those who are in mental distress, or our heroes, our veterans. This legislation will work against everything you have been trying to do to curb suicide. Like Matt said, there were 49,000 suicides in this country last year. Every 11 seconds, somebody ends their life. Suicide risk increases by 2.58 times in families with a completed suicide. So I ask that you take into consideration not only the person who wishes to die by assisted suicide, but consider how this impacts an innocent family. Take into consideration how this impacts society in general. Legalizing assisted suicide normalizes suicide for all. The second harm I would like to talk about is that this bill is rife with potential abuse and coercion. Senator Holmes, you said, or Senator Castro, you said, well, give us facts, give us facts. So I've been desperately trying while waiting for this is to give you some facts. I would point you to, and I think Sebastian referenced some of this information, but there's a group called the Disability Rights Education and Defense Fund. If you go on their website, DREDF, it lists some Oregon and Washington state assisted suicide abuses and complications. Sebastian listed one of those complications of the woman he talked about. That website is listing a number of them. Here's the problem we have, though. In the legislation that is enacted in other states, those states really don't want to know. They don't really have robust reporting requirements. So that's why websites like this exist. So to date, what we need is more robust oversight to make sure there's no potential fraud and abuse. There's no state oversight in this program, really. The reporting requirements that are listed in the bill come from doctors who have prescribed the prescriptions to help somebody end somebody's life. Those doctors have civil liability and immunity protections. So where are we supposed to get objective information to make sure that there's no coercion going on? I want to point your attention to something called the Journal of Academic Forensic Pathology, something I just looked up while I was waiting. I don't regularly read this journal, but I want to just list the excerpts of it to give you a sense of something was going on in Canada. A blatant situation that's published through the College of Physicians and Surgeons of just being completely unprepared and bringing wrong medications. They brought scopolamine and Ativan. Those were the drugs that the clinician brought to the home to administer MAID. And it was just horrible. It was horrible. The family, and I'm talking about what's public, so there isn't anything non-public. The family and the deceased person suffered tremendously. My point is, it really strains credibility to think that since 1997, when this was first enacted in Oregon, that nobody's been coerced. There's been no complications ever. You know there have been. No one needs to be present in the Illinois bill when the patient self-administers the drugs and dies alone. Once the doctor approves the pills, he or she is out of the picture. because no medical professional is required to be present. What happens when there are medical complications like I just described in Canada? There's no meaningful protection to prevent abuser, or self-interested persons from administering the drugs to a sick, elderly, or disabled person against his or her wishes. Because the patient could have had the prescription for months or maybe even years, who verifies that the patient can make the final consent? What if the patient changes their mind and they live with a family member that forced that person to take the prescription? Once again, how does the state know there was no coercion? How many mistakes due to a misdiagnosis is acceptable? How many deaths due to coercion? 1 in 10, 1 in 100? You tell me. The other harm to this legislation that I'd like to talk about is regarding the role of insurance companies in the healthcare industry. That was previously brought up, so I won't want to spend too much time on that. But legalized assisted suicide will sadly, but foreseeably, alter the landscape of treatment options offered to patients and covered by insurance providers. Everybody in this room has probably had a claim for insurance denied or knows somebody who's had a claim for insurance denied. Just Wednesday, Governor Pritzker, in his State of the Budget address, said that we need to do something about this. People are being denied coverage for mental health and behavioral health coverages, and he wants to do something about it. So he's admitted that this is a problem, and we know this is a problem. Steering patients to their death is often easier and cheaper than care options that extend patients' lives and eliminate pain. In states where assisted suicide is legal, insurance companies have already turned down coverage for cancer treatment while offering to pay for lethal drugs instead. We're in regular contact with Dr. Brian Callister in Nevada, who I think is going to come to Illinois and can tell you about his experiences here. I know the slippery slope argument's been touched about. Let me mention just something about that briefly. And Senator, I think you have the list I was going to give you about all of the efforts to, about the safeguards to be expanded. I can give you that sheet. It sounds like you may already have it. But I just want to point out this. No state which has legalized assisted suicide has tightened eligibility requirements after initial passage. Conversely, there are states, as we've heard, that once restricted assisted suicide to end their own residents that have changed their law to allow anyone to come to their state to end their lives. There are states that are trying to eliminate a terminal diagnosis requirement. There are states trying to expand assisted suicide to dementia patients. And there are states do not like the requirement that the pills have to be swallowed orally and would like to do them intravenously. As it said before, and as I think Matt said so eloquently, the harm of legalizing assisted suicide far outweighs any purported benefit. The advances in palliative care and hospice care are the compassionate answer to end of life issues. The better path forward for our state is to expand palliative care and hospice care that offer pain management, symptom relief, quality of life, and family involvement. Thank you for listening to my comments.